But without further ado, we are very lucky to be joined by, for the final talk before our panel, the Professor Emeritus Patrick Parkinson from Queensland School of Law.
Oh.
Hello, I'm Patrick Parkinson. I'm sorry I can't join you in person today. I've been asked to talk about the legal issues involved with gender dysphoria or gender incongruence and the treatment of children and young people. Let me break it down into three major issues to talk about. The first one is how we regulate this area. The second one is what the liability risks are for doctors and hospitals. And the third one is about the impact of conversion therapy legislation. Now, the position on the first one is that there is very little regulation at all in Australia now on the treatment of gender dysphoric or gender incongruent children and young people. There used to be. It required the consent of the court to proceed with those treatments. But in Ray Kelvin in 2017, the full court or the family court said that if both parents consent and the doctors are recommending it, there's no need for court approval. Now, that comes with two very big limitations. First of all, there has to be a diagnosis of gender dysphoria in accordance with the DSM-5 criteria, the criteria set down in the major psychiatric handbook. And one of those criteria that has to be satisfied is there must be clinically significant distress. It's not uncommon these days to find young people who say that they are transgender or they are non-binary, but they're not distressed about that at all. It just take it in their stride. They don't meet the criteria for gender dysphoria under the DSM-5, and therefore it would be unlawful to be prescribing them with puberty blockers or cross-sex hormones. The second limitation is that the treatment must be authorized and implemented by a multidisciplinary team. That was the promise made essentially by the Royal Children's Hospital that in Melbourne persuaded the court that they had standards which were rigorous, that there was a multidisciplinary team which would conduct a thorough assessment. That team including psychiatrists, psychologists, endocrinologists, pediatricians, who could assess all aspects of the case very carefully. It is not lawful for GPs to be initiating the prescription of these drugs, even with both parents' consent, without an order of the court, because the whole basis of Ray Kelvin was that there should be a multidisciplinary assessment by a clinical team in accordance with the Australian standards, which were then presented as being best practice to the court. So if parents don't agree, then one parent refuses consent, the other one wants to proceed, then it has to go to court. And in a number of cases, that is happening. And one of the great things about that is that the evidence can be thoroughly tested. The doctors have to persuade an independent decision maker of the thoroughness of their assessment and the necessity, the absolute necessity of this treatment. And let me say that pushed in that way to justify what they are recommending, not all of them are able to do it. Well, that brings me to the second area of liability, which could become huge in coming years, the risk of being sued. That gives me no joy. I'd much rather not have anybody injured and damaged by this movement. But the reality is that many are and are going to be, and they will have their remedies in court. And those remedies could be on one of three lines. The first one is that the doctor was negligent in diagnosis, that he or she did not consider, or the team did not consider, the impact of other mental health difficulties, such as being on the autism spectrum, as an explanation for why they may be gender dysphoric. Now, this is a question of belief, essentially. If you believe that every child has an innate gender identity and that just waits to be discovered and that we must then affirm that child's gender identity, if that's your belief system, you won't believe that there's any possibility that other mental health issues could be masking and lying behind a presentation of gender dysphoria, but that's going to be an issue that the courts will look at with very great seriousness in coming years. The second issue is whether the child or young person was given enough information to give an informed consent. And frankly, looking at some of the materials that I've seen, even quite recently, they haven't been. One of the big issues on which children and young people do not seem to be much informed is the impact of the treatment on their adult sexual functioning. That impact is severe. That impact may mean that for a boy who's put on puberty blockers, going on to cross-sex hormones, his testes may never mature. He may never have an orgasm in his life. That's the reality. And for girls, other significant impacts from vaginal atrophy and other effects of testosterone on the body. So these are things that ought to be thoroughly canvassed amongst many other issues in terms of long-term health risks. The law requires that even quite remote risks be made known to the patient before they can give an informed consent. Well, that brings me to the third issue. Can a 15-year-old, 16-year-old give that informed consent? You may say, well, they can do all sorts of things at that age. Well, yes, but a lot of these young people suffer from other mental health burdens. They are on the autism spectrum in disproportionate numbers. They have other difficulties, anxiety, depression, ADHD, anorexia. These are some very unwell teenagers. And can they consent? Can they understand the long-term implications of the treatment that is being proposed for them? These are really big issues that will be canvassed in the future, and I don't think the outcome is going to be favorable to the hospitals and the doctors. The third thing to say is about conversion therapy laws. These are having a devastating impact because, remember, so many of these young people are not only presenting with gender incongruence, some gulf between their natal sex and how they identify, but they also have many other significant mental health conditions, or one or two other significant mental health conditions. And because the conversion therapy legislation is so draconian, even I've come across LGBT clinics have been saying, we're not going to touch these kids. It's too risky to risk complaints to the regulators, to complaints to the health professional organizations, and even a criminal case. And the result is that, as I understand it, these kids are being turned away and they're not getting the other mental health treatment that they need. Now, you may say, well, you could treat the ADHD or treat the other mental health issues, but kids present as a whole, that you can't really segment one part of the presentation away from its totality. And so these are some of the big legal issues that I hope as parliamentarians you will consider. The conversion therapy legislation has been a dreadful mistake. I think it's going to increase suicides, increase long-term mental distress for many young people. And let me finish by reminding you how many members of the Victorian Parliament voted in favour of that legislation. Thank you.